Good morning. This is Bob Marcelo. An estimated 21 million Filipinos above the age of 15 are denture wearers, according to a recent survey. In percentage terms, this translates to 33% of the population and is the highest among the world's market. In other words, roughly 1 out of every 3 Filipinos wears dentures. Single complete denture. What is its indication? Fabrication technique and clinical consideration. And now, let's ask the people if they really know what single complete denture is. We have Homera Kokar.
No. Thank you, Bob. We are now at Dentay Lanay to ask clinicians if they have any idea what single complete denture is. Let's go. Hi.
Hello.
Do you have any idea what single complete denture is?
No.
Really? Okay, thank you. Let us find more people who knows about single complete denture. So let's ask them if they know anything about single complete denture. Hi, do you know anything about single complete denture?
For 1 hour.
Yes.
Personally, I think it's large denture,
Complete denture.
complete denture with opposing, it's either complete denture or with RPD or NPD.
Okay, thank you. So let's find more. A single complete denture is a complete denture that occludes against some or all natural teeth, a fixed restoration, a previously constructed RPD. And now, let's know the indications from Ms. Clara Alpuerto.
Thank you, Omera. For the indications, a single complete denture may be desirable to oppose any of the following. First, a single complete maxillary denture to oppose natural mandibular teeth. Second, a complete maxillary denture to oppose a partially edentulous arch and a removable partial denture. And last, a complete maxillary denture to oppose a dentulous mandibular arch with fixed prosthesis. This is Clara Alberto reporting. Back to you, Bob.
Thank you, Clara. And now, for the fabrication technique, we have Mark Roland Torres.
Yes, Bob. For the publication techniques in single complete denture, there is a suggested clinical and laboratory procedure. First, case history. The dentist should know the intraoral examination of the patient, all operative. If needed, periodontal and surgical procedures for treatment. Examine staticas to be secured on an articulator to visualize. Check inter-arch space. Find arch relation and occlusal plane. When there is occlusal discrepancies in the natural teeth are judiciously equilibrated on the cast and mark, procedure is duplicated in the mouth. All ground enamel surface should be polished. If sensitivity is encountered, it can be readily handled with local application of sodium chloride. Impression procedure is carried out in considering the clinical situations. Should be accurate and detailed. Basebound record is transferred and maxillary cast is secured on the upper member of the articulator. Centric relation is made in wax of past-setting plaster and mandibular cast is mounted on the lower member of the articulator. In selection of artificial teeth, the acrylic resin teeth are acceptable. Acrylic resin are selected opposing a prosthesis with acrylic resin teeth. Precautions in teeth arrangement. Deep vertical overbite be avoided in the anterior region, which results in less stress on the anterior teeth and thereby lends increased stability to the complete denture. Increasing the horizontal overbite is one method of reducing the incisal guide angle. it is essential that there be no lacking in the anterior segment. The last is the sending to the laboratory for processing denture. Make sure the setting of the teeth in the wax are properly arranged in position before process.
Thank you, Mark. And now, for the clinical considerations, let's have Rene Villajuan.
Yes, Bob. For the clinical consideration, it can be divided into two, systemic and dental factors. For the systemic factors, diabetes and osteoporosis can increase the rate of resorption of the bone. For the dental factors, in case of class 3 jaw relationship, there will be increased pressure on the anterior of the maxilla. And for when lower anteriors are retained for a long time, the patient is accustomed to bite in the anterior region, and the presence of the parafunctional habits increases the bone resorption. And lastly, the type of occlusal scheme also has direct effect on the development of the syndrome. Rene A. Villajuan reporting. Back to you, Bob. Thank you.
Thank you, Rene. And now, we know what single complete dentures are. We hope that you've learned something from our group. Thank you for listening, and don't forget to smile. Have a great day!